Hi, welcome to My Normal Matter of Strength Conditioning. My name is Oscar, and today I want to address the issue of carpal tunnel syndrome. Now, carpal tunnel syndrome is a condition where pain and swelling usually occurs on your wrist, and this is due to numerous repetitions of the wrist, where you put a lot of stress over it. So a lot of repetitions like typing, playing golf, sewing, any unnecessary, unusual amount of repetitions will cause stress to that general area. Now, this video will help you rehabilitate carpal tunnel syndrome and hopefully help you prevent from getting surgery. Now, the first thing that you should know about carpal tunnel syndrome is that it is reversible, and that you could actually benefit from doing exercises and stretching. So this video will be just a background information, and then I'll give you some stretches and some exercise guidelines that you can do to hopefully alleviate your pain. Now, the first thing that you want to know is that there's three nerves that innervate your wrist. Now, the nerves work as a conduit to send information from your brain to the muscle. Now, the three nerves are the ulnar, the medial, and the radial nerve. Out of those three nerves, the median nerve is actually responsible for carpal tunnel syndrome. That's the culprit. Now, every single person in the world has carpal tunnel. Carpal tunnel is made of retinacula, flexion, and extension. These bands that come together. Now, the flexor retinacula is the one that creates a bridge, and this bridge creates an opening where tendons and ligaments go together, and also muscles and all these really important structures. Now, after repetitive motion, what happens to your wrist is that the little bridge where all the nerves and all the blood vessels go gets smaller and smaller, and then it aggravates that area to the point where swelling occurs, and to the point where every single touch is very painful. So stretching and exercising would actually help alleviate those muscles. Now, the wrist, the movements of the wrist, they only do a couple movements. The first one is extension, so they extend your hand, and the other one is flexion, where they flex. The other couple movements is called radial deviation and ulnar deviation. And those are important movements to know, because those are the ones that you want to do when you stretch and when you exercise your wrist. Now, I also want to spend some time talking about the thumb. The thumb is very specific. It has its own movements and its own nerve that it gets information from. Now, the thumb can also extend and flex, but it can also, you have an opposing thumb, which is very unique to mammals, specifically humans. Now, these ones will come into play because a lot of repetitive motions, like typing, is done through the thumb, and it puts it in a really uncomfortable position where the carpal tunnel, actually with the bridge, the opening, it's actually the gateway, so we've got to address that. So hopefully that was a little more information that you guys want to know about carpal tunnel syndrome, but I think it's beneficial to know exactly what caused it and what are the remedies to rehabilitate carpal tunnel syndrome. Now, let's get started with the warm-up. Alright, the first thing you're going to do is you're going to perform wrist circles, clockwise. Now, you're going to have your hand rested against your knee, or just rested, so make sure that you're not using any other muscles. And you want to go into a full range of motion. Now, if this bothers you or gives you any pain for whatever reason, please stop and skip this routine, or you can either decrease the range of motions of the circles, so that way you're still moving it, so you're still giving the blood flow that you want to be able to recover. After you're done doing 20 or 30 seconds of this, you want to go the opposite way, so you want to go counterclockwise. And once again, the hands should be well rested, so as you can see, my knee is helping my elbow rest and making sure that I'm getting full range of movement. And once again, if this bothers you, don't do it, or if it only bothers you one movement, don't do that movement so much, because you want to be able to make sure that you still get the blood flow, but it doesn't not cause you any pain. Now, the next set of warm-up routine is called your wrist flexion and extension. Now, in these ones, once again, you're going to keep it right next to your knee, or a place that's stable that only uses your wrist. You're going to go up and down on the wrist. And once again, if it causes you any pain, don't do it. And you can actually make a fist or keep your hand straight. Now, doing this will help warm up the muscles before you either stretch or before you exercise. Now, this will help because it will help warm up those muscles and make sure those muscles are warm up so they can be either properly stretched or properly exercised. Now, this one's called wrist ulnar radial and deviation. Now, what you're going to do is you're going to have your palm facing down right next to your knee. You're going to go out to the side and go back in. Now, most likely on the way in, which means leading with your thumb, will cause you a little discomfort. Try not to go so much because that's usually where the medial nerve is located, and that's the one that's being impinged. So you want to go the opposite direction more. You want to go more ulnar deviation. You want to perform the warm-up routine before you stretch and also before the exercises. For those videos, just go to my channel and continue this routine. Thank you so much and have a nice day.